Okay, well, good morning, everyone. My name is Kate Sugg, and I'm a program administrator with the Westchester County Youth Bureau. Welcome to our review of COVID-19 protocol and guidelines for school-age children. Keep your microphones muted until we open up for questions and comments. Also, we are recording the session, and we will add the recording to the video library located on our Youth Bureau website at youth.westchestergov.com. I would now like to turn it over to our presenters, Catherine Mancini, Director of Healthcare Consultant Services with the Child Care Council of Westchester, and Catherine's colleague, Lindsay Tiernan Icovello, Director of Provider Services, also with the Child Care Council. So go ahead and take it away, Catherine.
Great, thank you, Kate. Good morning, everyone. Thank you for joining us. Kate reached out and asked if we could go over the guidance, the ever-changing guidance that OCFS has been providing for childcare, which is based basically on the CDC guidance as well as New York State Department of Health. So the most recent guidance from OCFS was put out on February 4th. So that's the guidance that we will be reviewing today. It is current as of today. As we all know, things can change in a dime. So just, keep in mind and keep checking for those Dear Provider letters or any emails from OCFS as to any changes that may come up. But let's dive into it. So if we can get to the next slide. So just going over a few common COVID terms, I think we're all familiar with these, but just to make sure as we move forward that we're all on the same page. A close contact is someone who has spent a total of 15 minutes or longer within 6 feet of an individual who is infected with COVID-19. That time frame is cumulative over a 24-hour period. So if you spend 3 5-minute intervals with an individual, that's 15 minutes, and that would count as a close contact. A positive individual on the day that they either test positive if they're asymptomatic or develop symptoms, they're considered contagious for the 2 days prior. Okay, so anyone who's coming in contact with any of those two scenarios within the 2 days leading up to that day, they are considered close contacts. And I have a visual later on in this that helps a little bit seeing that. Isolation. This is the separation of a person from others who's known to have or reasonably believed to be infected with COVID. We can move on to the next slide. Quarantine, that's the separation of a person who has been exposed to someone or who is showing symptoms and is believed to possibly have COVID, and they're being kept separate from others in an attempt to prevent the spread of COVID. A viral test, there have been a lot of questions about this. I know there's a lot of information, PCR versus home antigen test. Really, CDC recommends viral tests, and both PCR and home rapid tests are considered viral tests. So whenever we mention test at this point, either of those would be acceptable. We can move on. So things kind of changed as far as the wording when we're talking about vaccinations. CDC uses the term fully vaccinated for a person who has received the primary series of the COVID-19 vaccine. And you're considered fully vaccinated 2 weeks after your final dose. So that would be 2 weeks after the second dose of either Pfizer or Moderna, or 2 weeks after your J&J dose. Up to date is the new term that they've added, which means a person has received all the recommended COVID-19 vaccines, including any booster doses when eligible. Okay. And the people who are eligible for those booster doses as of now is everyone aged 12 and older can get a booster at least 5 months after the last dose in their primary series. Everyone 18 and older also should get that booster dose at least 5 months after the last dose in their primary series. And anyone 18 and older can get a dose of Pfizer or Moderna at least 2 months after their first dose of the J&J vaccine. You are considered boosted and up to date right after you get that booster dose. We can move on. So the OCFS mask mandate was updated on February 10th. I know there's been a lot of discussions within New York State about masks in schools and in general. If you are an OCFS regulated program, you are following the OCF mask mandate. It was updated on February 10th, and it was initially implemented on September 16th. Anyone older than 2 is required to wear a mask while in the program. The only exception would be if you have a medical exemption not to wear the mask. That would be the only way that you would not be wearing a mask if you're older than 2. These emergency regulations remain in place through April 17th of this year. If anything were to change, OCFS will notify you. So this is regardless of what the schools end up doing. You need to continue to follow the OCFS regulations. Okay. Do we go ahead too, or is this the next one? Okay, thank you. So this is where we're going to start with the OCFS guidance that was sent out on the 4th. A child of any age or adult who has symptoms of COVID-19 is waiting for a test regardless of their vaccination status, okay? So anyone with symptoms of COVID-19 has to stay out of the program for 5 days or until they receive a negative COVID-19 test, whichever comes first. If the test is negative, symptoms are improving, they can come back to the child care program. If the test is positive, they're going to follow those isolation rules for a COVID positive. Next slide. So here's where we get into if a child of any age or an adult who tests positive for COVID-19, regardless of vaccination status. So anyone who tests positive for COVID-19 has to stay out of the program for at least 5 days. Anyone testing positive who's not experiencing symptoms has to isolate for the 5 days. After the 5 days, they can return to the program if they're 2 or older and consistently wear a mask while in the program. Anyone who's tested positive and who is experiencing symptoms has to isolate for those 5 days, and they can return to the program after the 5 days if they are fever-free for 24 hours without medication, fever-reducing medication. And they also have to show improvement in their symptoms before returning to the program. They also would have to wear the mask days 6 through 10 at all times while in the program. Anyone under the age of 2 or anyone over the age of 2 who cannot reliably wear a mask for any reason, who is tested positive for COVID-19, has to stay out of the program for a full 10 days. So if you have any children in your program who have a medical exemption for wearing a mask, they were positive, they would have to stay out for 10 days. Anyone hospitalized with COVID-19 or any immunocompromised individual would also have to isolate for at least 10 days and consult a physician before returning to the program. Next slide. So here's just a visual just to show you if you're testing positive for COVID-19, that day 0 is the day you first develop symptoms. If you're asymptomatic, day 0 is considered the day they collect the test. Either collect it for a PCR, you may not get your results for 1 or 2 days, sometimes 3, or you do the home test and you're collecting it that day, getting the result in 15 minutes. That's your day 0. That's the day you're going to start to isolate. And that's the day, if you test positive, that's the day you're looking back 2 days. Okay, so if day 0 is a Monday, you're looking back Sunday and Saturday. Who were you in contact with? And you want to let those people know that you're symptomatic You either have a positive result or you're waiting for one. And if you eventually do get that positive, to let them know that. So then you go on, you're isolating. That next day is day 1, and you're isolating through day 5. On day 6, if you have no symptoms or your symptoms are resolving, you can end isolation. If you're unable, again, to wear that mask, you're going to have to continue for 10 days. Those days 6 through 10, you're wearing a well-fitting mask while around others. Day 11, in the general public, you may stop wearing that well-fitting mask. You still are wearing that in program because OCFS has a mask mandate. If you are symptomatic and those symptoms are not resolving by the time you get to that day 6, or you still have a fever, again, you're going to continue to isolate. Okay. We can switch to the next slide. So a lot of people have the questions of, mainly for you guys, it would be while eating. You know, some of the younger kids, we also have the question about napping, but this is what the CDC has directed as far as times in a program where children don't wear masks, such as during meals, snacks, nap time. And the recommendation is to keep children returning from isolation 6 feet apart whenever possible, while still safely under your provider supervision. Okay, and you can consider using additional prevention strategies, which you should all have been doing, you know, from the beginning, which is improving your ventilation, cohorting, especially when that consistent mask wearing is not feasible. Again, for you guys, it's most likely when they're having a snack. So you really want to try and separate anyone who's come back that day 6 through 10 during those times and is not able to wear a mask. We can switch to the next slide. So this is where the quarantine, you know, this is where a lot of changes have come in recently. And really a lot of this is determined on what the vaccination status is of the individual. So quarantine is used for somebody who is considered a close contact of an individual who's tested positive. If the person who is the close contact has not received all the recommended doses of the vaccine, including the boosters, if they are eligible, or they are unvaccinated. So this is all unvaccinated and anyone who is not up to date, that term we went over in the beginning, okay? You're eligible for that booster, but you have not received it, or you received maybe one of a 2-dose vaccine and have not received that second dose. You are in this group, okay? And then you go over to the right. Anyone over the age of 2 years old may return to the child care program after 5 days of quarantine if they're able to wear a well-fitting mask and if they are not experiencing symptoms. Children under the age of 2, as we've already talked about, as well as anyone who cannot reliably wear a well-fitting mask, must remain out of the program for a full 10 days. And they can return to that program after the 10 days, provided they're not experiencing symptoms. If a person under quarantine develops symptoms while they're there, they must follow the isolation guidance. And then they can return once they've either tested negative or if they've tested positive once they've completed the isolation period. If a person under quarantine has not had confirmed COVID-19 in the last 90 days, the testing is encouraged on day 5 when possible. So once you've been exposed and you're in quarantine, the recommendation is that on day 5, you get a test, regardless of symptoms. We can move on to the next slide. So this is, again, just another visual, but this is now the quarantine that we're talking about, okay? If you're exposed to someone, you're going to stay home and quarantine. You start wearing that well-fitted mask around others, quarantine through day 5. Again, day 5 is when you want to get that test just to rule out the chance that you possibly have asymptomatic COVID. If it's positive, you're going to begin your isolation, and if negative, you continue with that quarantine. Day 6, you could end that quarantine. You still need to keep wearing that well-fitted mask around others, And if unable to, you're going to continue the quarantine for 10 days. Again, well-fitting mask. Day 11, you can stop in the general population, but OCFS still has that mask mandate, so you're wearing that in program regardless. If at any time you develop symptoms, you're going to get tested, stay home, and avoid contact with others. And then if that test were to come back positive again, you would then start to isolate. We can switch to the next slide. So here's what happens. If you have received all of your recommended vaccine doses, including your boosters, if you're eligible, so you're now considered up to date. You've gotten all your doses of the primary vaccine and you've gotten your booster. Or if you have had COVID-19 within the past 90 days, or if you are a staff member or a school-age child who has been approved to attend school under a test-to-stay protocol in their school district, regardless of vaccination status, you may return to the program and no quarantine is required. If you start to develop symptoms, you would then follow that first scenario that we went through and either get a test done or stay out of the program. Just assume that you haven't stayed out of the program. If a person under quarantine develops symptoms, you have to follow the isolation guidance, and all that goes into that before returning to the program. You would need to wear a well-fitted mask around others for 10 days. We're doing that regardless because that mask mandate is still in effect. If you haven't had confirmed COVID-19 in the last 90 days, testing is encouraged on day 5 again, when possible. Okay, so the staff member or school-age child, that third scenario down there, you as a program are not implementing that test-to-stay protocol or program. That will have been, you should be aware of what's going on in your school district. If it is already established and that district has implemented that program, and you have a staff member who works at the school and is participating in the test to stay, or a child who is, and they are cleared to be at school through that test to stay program, then they can attend the after school or before school SAC program. So that's what that was sort of the newest addition that OCFS added to this guidance. It's not changing anything that you are doing. Again, you are not implementing this test to stay program. You're not authorized to do so. It's just if it's already happening in the district, anyone who is participating in that and is cleared to be at school can also be in your program. We can move to the next slide. So this is the New York State Department of Health statement that they support the test to stay as a strategy that allows asymptomatic eligible close contacts who are subject to quarantine, according to the updated New York State Department of Health isolation and quarantine guidance for school settings, and that would be students, teachers, school staff, to attend school and applicable school-based extracurricular activities and childcare for school-age children by testing negative through serial testing using the rapid NAAT or antigen test during a 5-day period following exposure. So again, this is for people who would otherwise be quarantining. This is not anyone positive is isolating. If you're positive, you're positive. You're not in that program. You're isolating. This is for the close contacts who remain asymptomatic and again are involved or in their school's test to stay program. We can move forward. So this is what the OCFS Dear Provider letter, which was dated on February 4th of this year, sent this out to all programs to note that the Department of Health has recently issued guidance for K12 schools. That guidance does not generally apply to childcare programs, except that children and staff participating in test to stay programs in their school district in order to participate in school are allowed to continue to ride the bus and may attend a program licensed or registered to provide childcare to school-age children. Whether that is on site at the school or off site at a different location, and whether they include students from a single or multiple schools. And this is, of course, in which all appropriate mitigation strategies are followed: masking, hand hygiene, which you guys are all doing, I'm sure. And again, all the mitigation strategies are followed closely, including a well-fitting mask, frequent hand hygiene, and other recommended practices. We can jump forward. Reporting. I just want to touch on this. Anytime you guys have a positive case of COVID, you need to let your licensor or registrar know. They are tracking this, and they have a form that they'll provide you with that needs to be completed and submitted to OCFS. Okay, so make sure anytime anything that you hear of as far as COVID-19 within your program, you need to let your licensor or registrar know. And if you're questioning whether or not they should be aware of it, just make the call, and they'll let you know. Westchester Department of Health, they want to know about any positive cases that have a direct effect on your program. So if someone, say wakes up on a Saturday morning and they're symptomatic, someone that was in your program that past week, again, we're looking back those 2 days. So they contact you on Saturday. They say, I felt sick this morning. I took a test. It's positive. You're looking back to Friday and Thursday. Anyone who was considered a close contact on those 2 days, you need to let the DOH know, one, about the positive case, and then about any of the close contacts that may have occurred during that Friday, Thursday time period. They do not want you to report, or they don't need you to report. If someone calls you on a Monday and they woke up Monday morning, felt sick, took a test, and were positive, well, we're looking back now to Sunday and Saturday. No one in the program was affected. The positive individual wasn't in the program during their transmissible time period. It really has not affected your program. You do not need to report to the Department of Health those cases, okay? They have asked that you guys fill out an Excel spreadsheet. I sent that to Kate. She's gonna, if she hasn't already, I think she may have, she'll forward that Excel spreadsheet. And on the top, there's an email address that they want that spreadsheet emailed to them. And you can also reach out to that email address if you have any questions on how to fill out the form, but there are directions and all with it. So, feel free to reach out to them. Lindsay, do you have anything to add as far as OCFS and reporting? Oh, you're muted. Lindsay, you're muted.
Sorry.
That's okay.
I would say email your licensor and registrar as soon as possible. They'll probably send you a form that you need to complete, and then there's an online link to a website that would need to be completed. So if you have any questions or you're not sure if you should be reporting, send an email. Typically, we're able to check our email when we're out in the field, so we'll be able to get back to you as quickly as possible. You can always email me if you're unable to get the registrar who's assigned to your program.
Great, thank you. And then we could move on to the next slide, I think. Yeah. So that's the gist of it, the overall guidance. But we're open to any questions, concerns, anything you guys might want to ask. I have not seen the chat if there's anything in there.
So, Catherine, thank you so much. I am monitoring the chat. So if anyone wants to enter a question in the chat, you can do that. You can also feel free to unmute and go ahead and ask any questions that you might have. Catherine, if there are any changes made to the guidelines that you just went over, as we were discussing before we jumped on, CDC has already made some minor changes. I assume OCFS will go ahead and provide another letter, a provider letter to all SACC licensed programs, so they'll be aware of any changes?
So they provide the changes when it pertains to their guidance. But so that particular change that happened yesterday with CDC was more in the lines of the suggested time frame between vaccines. OCFS would not send something out for the CDC updates if it doesn't directly, affect them. But if anything in this guidance itself that we just reviewed were to change, or the mask guidance, and again, that's good through April. But if something were to change, they should send an email, and they tend to do that through the Dear Provider letter. So you just need to be looking for those. But it's always a good idea to jump onto that CDC site. Again, things are changing constantly, and it's a good idea to keep up as much as you can.
Great, thank you.
Sure.
Any other questions from programs about the test to stay in schools and how that might affect your after school program, or about the OCFS mask mandate? Well, I think the no questions is a good sign.
I'm hoping we got it. We hit all the marks, right? Hopefully.
Absolutely.
That's great. I'm
Well,
available anytime. Kate, feel free, to share my contact information. If questions do come up, I'm happy to talk to anyone, answer any questions, walk you through the guidance if you feel like you just need, someone to talk it through with. Yeah, so feel free.
that would be great. Thank you so much, Catherine. I will go ahead and email your contact information. Lindsay, do you mind if I include you as well? Excellent. And then everyone should have also received the spreadsheet from me for reporting to DOH. I believe I had one person that registered last minute that did not receive it, so I will go ahead and send it out to that individual. Otherwise, I just want to thank you, Catherine and Lindsay, for taking the time to share this information with us, and for everyone for joining us this morning. A reminder that the recording of today's training can be found on the video library on our Youth Bureau website. That site is youth.westchestergov.com. Also, I just want to issue a reminder about our next professional development opportunity. It will be held on March 3rd, and the focus will be co-occurring disorders and youth mental health. And if you're interested in registering for that, you can go ahead and email me directly. My email is kmh4@westchestergov.com. So if no one has any questions, then I think we can wrap up. I just want to, again, thank you, Catherine and Lindsay, and thank you to all of our attendees for joining.
Thank you.
All right, have a great day, everyone. Thank you so much.
Take care.
Bye-bye.